there's a financial commitment as well, isn't there? Which, do you want to talk about that?
Yeah, I think, well, to be prepared. I mean, it's if we compare it to spinal surgery or something, where you could be looking at anywhere from 12 to 16,000. Our lower end ones are about 1,200, and the upper end is at 2,500 for care. The majority of people will fall within the 12 to 1,500 range. I think so far we'd probably say we're about 85 to 90% fall within that range. If people are using it as an individual visit, it's £80 a visit. And they might want to use a few visits in association with their chiropractic care because they just need a little bit of relief from it. But they don't have a significant enough problem to go into a protocol. Yeah, that's the way the financial commitment works. So it's anywhere from 12 to 2,500. And then the payment system works that it's 50%. Whatever protocol you do, it's 50% up front, and then you can divide the other two into 50-50, 25 and 25%, 4 weeks and 8 weeks. So it makes it a little bit easier to spread it out over time. But I'm always conscious to advise people that that are getting involved. And a couple of people have done this where they start seeing a bit of relief and they reduce their frequency. They've paid for it. It stands to reason that if you're going to pay for it, commit the time to go through with it to get the best result. Yeah, your symptoms can waver. They can go up. They can go down. I understand. The thought that, hey, if I'm feeling better, I should start to I can reduce this or miss this one because it's not kind of a prevalent thought in your mind. But you should be thinking about trying to maximally correct the underlying issue as best as possible. And in order to do that, these protocols follow an evidence-based approach to do that.
Yeah, I think it's the same principle, isn't it? When your doctor gives you some antibiotics and they say even if you're feeling a little bit better, see that process through because it's no pain, no problem is sometimes how we can all see it. But I think it's important because we're trying to get long-standing change to long-term problems, but we don't just get excited about that first bit of relief and try and actually make sure we fully get on top of these issues as well.